Greetings friends, time once again to put down your pencils and put away your notebooks. Today's Friday film explores the use of X-rays in curing disease. Today's title, Radiotherapy, High Dosage Treatment.
The nurse technician who administers radiotherapy must have a precise knowledge of the equipment which she operates. She should also have an understanding of the physiological effects and psychological aspects of X-ray treatments upon individual patients. These qualifications are essential since the technician must cooperate very closely with the doctor, nurses, and others who are administering the medical and nursing care prescribed for each patient. The case history of Mrs. Gordon illustrates how the doctor diagnoses and prescribes treatment, while the nurse and technician assist him, each performing specialized functions during treatment and post-care of the patient. Mrs. Gordon has complained of a growth on the underside of her tongue, which doesn't heal. Suspecting cancer, the doctor performs a biopsy. He removes from her tongue a small sample of tissue, which is sent to the pathology laboratory for an accurate diagnosis. Two days later, when the laboratory sends back Mrs. Gordon's biopsy report, the suspicion of cancer is verified. The doctor diagnoses her condition as carcinoma of the tongue and prescribes X-ray treatments immediately. Following the diagnosis, the nurse helps Mrs. Gordon overcome her fear of the disease and its possible consequences. The patient with cancer needs guidance in making the difficult personal readjustment which she is now facing. While the nurse talks with Mrs. Gordon, the X-ray technician consults the dosage specifications for the treatment. A full understanding of the factors which determine X-ray dosage involves a knowledge of the nature of X-rays. X-rays are produced when electrons traveling at high speed strike a metal target. The X-rays are given off from the target in all directions. But for the sake of simplicity, only one segment of the total radiation is shown. The quality of the X-rays produced depends upon the speed with which the electrons strike the target. This is governed by voltage. The number of X-rays produced depends upon the number of electrons flowing across the tube. This is measured by what is called milliamperage. As the voltage is increased, X-rays of a shorter wavelength are generated. While if the milliamperage is increased, a greater quantity of X-rays is produced. For medical use, X-rays are applied to fairly small areas, so it's necessary to restrict the radiation. A lead cone, or a lead plate with a hole in it, may be used to reduce the scattering of the rays. In actual operation of an X-ray machine, different types of rays are produced. Since some of these rays are of a type that is not desired, they're screened out by means of filters. There are three factors, then, which affect the type and amount of X-rays leaving the cone: the voltage, the milliamperage, and the kind of filter used. X-rays generated by low-voltage machines penetrate only the surface of the body. The high-voltage X-rays, however, will penetrate to deeper tissue. But whether the radiation is low voltage or high voltage, the nurse technician must know just how much X-ray energy actually reaches the area to be treated. The total effective X-ray energy reaching any given point is called the dosage. The dosage depends upon the factors already mentioned, the voltage, the milliamperage, and the filter. And it also depends upon the distance from the target to the skin, the depth of the tissue being treated, and the exposure time. On the patient's record chart, the nurse technician enters the prescribed dosage, the voltage, the filter, the target to skin distance, the milliamperage, and the exposure time calculated from the calibration chart. The portal, to cover the region treated, is the size of the opening of the lead cone. The region treated, in this case, is the tongue. When the treatment is to start, Mrs. Gordon's nurse introduces her to the nurse technician, who tells the patient how to prepare for the treatments. As Mrs. Gordon lies down, the technician again reassures her about her first treatment. The patient is made as comfortable as possible and instructed that she must not move during treatment. Sandbags provide firm support. Then the nurse technician quickly swings the X-ray machine into position and tightens the adjustment levers. And now the head is turned so the rays will be aimed correctly. The doctor holds the tongue in position with gauze. The technician gives him the clean cone he had previously selected for Mrs. Gordon's treatment. A flashlight provides a preliminary check of the accuracy of its placement. The doctor holds the cone in place as the technician slowly and carefully raises the table until the cone can be connected to the X-ray machine. The position of the cone is accurately checked by using a periscope. With it, the doctor can see if the malignant area lies in the path of the X-rays directly under the cone. Before the technician leaves, she makes a quick visual check of the treatment room. Not until the lead-lined door is shut can the X-ray be turned on, for a safety switch is there to prevent accidental exposure to X-rays. X-rays scatter about a room by a process of reflection and penetrate ordinary walls. But by lining the treatment room with lead, the scattered rays are kept within it. The door and the windows, too, are lead-lined. In this way, X-rays are confined to the area of treatment, which is important because the nurse technician should guard against unnecessary exposure to X-rays. The doctor now signs the patient's diagnostic card, on which the technician has entered all the factors about the prescribed dosage. By double-checking the exposure time and other dosage factors in this manner, the possibility of mistakes is reduced to a minimum. Because Mrs. Gordon's tongue has a growth of malignant tissue, high-voltage X-rays are being prescribed to achieve the desired therapeutic effect. These high-dosage X-rays have a lethal effect upon cells which gradually destroys them. However, normal cells are not killed as rapidly as the malignant cancer cells. X-rays, therefore, can be used to destroy cancer cells without permanently damaging surrounding normal cells, which can recover from the effects of the radiation. As soon as the technician has started the exposure, she observes her patient to make sure she's all right. When the exposure time is up, the machine is automatically turned off by the timer. Mrs. Gordon's first treatment is finished. The technician quickly lowers the treatment table. Before she leaves, Mrs. Gordon is given a schedule of appointments. During the course of treatments, Mrs. Gordon may find it difficult to swallow, as the tongue reacts to tissue changes caused by the radiation. The nurse shows her how to use soothing gargles and mouthwashes. By irrigating the mouth with soda solution, food particles are washed away, thus preventing infection, swelling, and pain. The nurse also explains the bland diet which the doctor prescribes for mouth and throat conditions. Mrs. Gordon's carcinoma responds well to a few weeks of treatment, but a hard core in the center of the tumor remains. In order to destroy this core, the external X-ray radiation is to be supplemented with interstitial radiation, radiation coming from within the tumor. That means a prescription for radon seeds. A radon seed is a tiny gold capsule in which a gas called radon is sealed. The gas comes from radium and is radioactive. Radiations from the gas have the same effect upon malignant tissue as X-ray radiations, but a radon seed can be implanted inside the tissue. The nurse who administers radon seeds should use great care in handling them. They're deceptively small and they look harmless enough, but their radiations are very powerful. They're delivered to the operating room in lead containers called applicators. The nurse selects from the applicator the correct number of seeds to make up the dosage prescribed by Mrs. Gordon's doctor. Notice how the nurse carefully avoids exposure to the radon seeds. She handles them with long forceps behind a lead shield, while putting them in a special lead container for sterilizing. Both the needles and the container are placed in the sterilizer. Now the seeds are inserted in the tips of the plunger needles. A smear of sterile Vaseline keeps them from slipping out. They're now ready to be implanted in the patient's tongue. After Mrs. Gordon's chin has been painted with antiseptic solution, a local anesthetic is injected. Then the seeds are implanted. They will be left permanently in the tongue. The radiation effect will continue for a period of weeks after treatment. During this time, the patient is under observation, twice a week at first, and then less frequently. With periodic medical checkups, Mrs. Gordon now may resume her former activities and live her normal life.
Thank you for your kind attention. Please remember to like and subscribe for notifications of future projects.